In patient management software, we have several problems to solve. In the management system, we are going to focus on 4 points. The first is the management of supplies. In the dental lab, you have like more than 1,000 kind of supplies that you're working with, and you need to be able to manage that. Working on an Excel file from time to time like this will not solve the problem. You need particular tools written for that. So supplies management, coming from the orders, then going to the inventory, talking about the expiry date. All this is linked to the management of supplies. The second step will be the lab orders management. You will receive the orders online, and then you will need to decide who is going to do what in your dental lab. Which materials are used to make every single work in your lab. And this is mandatory. By law, you have to edit the material that you've been using to edit a crown or any kind of prosthesis. Then lab orders are linked to invoices, and invoices are linked to payments and managing all the money which is out of the lab. So this is the second point, lab orders and management. The first, the accountant in one way or another. But the accountant will know nothing about the expiry date. The accountant will know nothing about the materials which are used to make a crown. This is not the part of the accountant. Accountant will manage the VAT, the declaration on VAT, will manage where the money is out. He will manage the group payments also, because they are not going to pay you one by one invoice. They are going to pay you by months based on a group payment, partial or full. And this will be organized in a good way, not using an Excel file again, but using a special program working in accountancy. And the fourth point is the network. In a dental lab, you are in close relationship to your suppliers and also to your clients. The orders you receive based on a piece of paper where someone is writing the orders is finished. This time is finished. Now everything will go online, and getting online, you will get the traceability. So if you are using E-MedicalManager for laboratories, all your clients, all of them, can have a special software for free, which is called E-MedicalManager Laboratory Orders. And they will be able to make you save a lot of time and energy, because they are going to send the pictures, to send their comments, to send their dates and details of the order. And this is the network. You have to understand that today you are not working alone on your side with a program which is installed on your computer. You are working on a network. And this is the 4 points that we will cover. First is about supply, second, lab orders, third, accountancy, and last, network. So we will cover that, starting from the control of items, control of the supplies traceability, on-time valuation of the inventory. If I want to know how much I have been buying and which is in my closet, how can I know that? Today, in one click, you can get it with E-MedicalManager. I'm going to show you how we do. And doing that, you will get the track of expiry items, the track of materials used to make a case, the export income and expenses to accountancy, the management of VAT, the control production and expenses. All this is included in this program. You can evaluate the item consumption if you want. You can export the payment details to the accountancy. You can track the statement of account of each client and decide to whom you're going to send a statement or a reminder. You can organize digital management of lab orders. So it's very easy. I will show you how we are going to work on that. Nothing to write, just scanning. Management of one-time monthly payment to the lab. Communicate with distributors and responsible personnel. Responsible personnel are the people working inside your lab. And this is how it's working in real. You have a program, which is an online program, which is called E-MedicalManager Laboratory. This will allow you to receive orders from E-MedicalManager dental clinics having the program and sending the orders to you. But if the people you are working with do not want to work with E-MedicalManager dental because they don't need, for example, you will supply to them the E-MedicalManager lab orders for free, and they will be able to send you that directly. And this will be a big advantage for you and big advantage for them for the traceability of what you are doing. So I will stick with these three, but we have 12 different programs. So I will not go into details in this lecture, but I will just show you that E-MedicalManager lab orders will help you to manage your lab. So we will go to manage supplies order, manage inventory, manage laboratory received orders, communicate internally and externally, manage custom report and VAT accountant, and security and confidentiality. We are working with patients, so we need to protect all that. And I'm going to show you how it's protected with SSL system. So to go into the program, we will go directly into the program. I just want to show you how it's working now. So on top, you have the everyday practice. Everyday practice are the tools you are using every day. So on top of that, you have the orders to the lab. This is where you receive the lab orders. You have the provisional schedule of the day, and you have all the details of what we work. This is everyday practice. Just under, you have the reports. If you want to know, get a quick inventory, you click here and you will get a quick inventory. No need to ask the accountant to tell you what you have in your closets. The next is the custom reports, where you can make the payment done in one time every month, and you can make an analytic consumption report. And you have at the end the settings. You will start by the settings. I don't want to go deep into the settings, but this will be the start of you using E-MedicalManager. For that, it's mandatory to have a kind of support. Of course, you can read the user manual where everything is explained, but it will be much easier to have a training online or directly in your lab with someone who is going to come for a full day in 2 times. First time, she will help you knowing what you need to implement and the way to implement. And second time, she will come again 4 hours to explain to you what you have, what results you have, and how you can work in a better way, because this will help you working in your everyday practice and save a lot of time. I have been writing 2 articles already in 2015 on the traceability, the orders, the inventory, but today the program is touching much more than that, and it's included all what is needed by law to do in a dental clinic today. So I want to introduce you one thing before I am going to start with the program itself. And this is the barcode. What you see, the bottles here are the barcodes that you have when you go to Carrefour, let's say, you have a barcode. And they are reading your articles on the barcode. A barcode is including only 10 to 13 characters. And you've seen already what we call the QR code. QR code means quick response code. And a quick response code is including 7,000 numerical characters. So there is a big difference in between the barcode and the QR code. And we have been selecting the QR code to implement and to save information that you have to deal with in your practice in a dental lab. I'm going to show you how it's working. We have been including in your program a QR code generator. If I write here, bonjour, okay, the QR code will be what you see on the right side. Bonjour will generate this QR code. Now, if I go to bonjour, how are you today? You will get this QR code. Let's go back and look at the right side to see the difference in between bonjour and bonjour, how are you today? You see the difference? Bonjour, bonjour, how are you today? When you scan that design, you will get the access to all what is written, and you can go up to 7,000 numerical characters. So this will avoid making mistakes in posting, in copying and pasting, or in entering on a keyboard what you need to enter on your case. This will be fully automatic. So this is mandatory. You have big ones like this. You have small one also. And we are designing that for you. And then the doctor, the assistant, the lab technician, everybody working in your system will be able to scan that. And I am going to show you how we do. So I will not go into more details about that. I want you to discover directly the program. So you get on this page, you click on login, and we go to E-Medical Laboratory, which is a lab. And on top of the lab, you have the planning supplies order. I'm talking about the supplies. Remember, supplies, lab order, accountancy, network. Now we talk about the supplies. You can select supplies based on the list of supplies. We have a list here. You can find it by category, subcategory, or by vendor. So I'm going to select ANPA as a vendor. And in ANPA, I am going to select, let's say, you need the angle conical abutment. And it will give you automatically your angle conical abutment. The lot is one for one component. It's per package of one, and you order one. The vendor is this, okay? And you have the quantity. Here, you have how many you have in stock. So without looking anywhere, maybe I had 2 or 3 in stock and I don't need to buy another one. And this will be written here. You will have the amount you have in stock. So let's say because I need that, I'm going to order one and I enter. It's entered. I don't send immediately. I wait to have a certain number of orders to the same vendor, and then I will decide to prepare an order to a vendor. In this case, we are going to make an order directly. The staff is Louise, the secretary. The vendor is ANPA Medical. So I click on ANPA Medical. The department, if you want to create departments like CAD/CAM, general supplies, orthodontics, removable, you can do it in the lab. If you don't want to use that, you just click on general supplies. Then you will view the order. This is the order. This is an email which is going to be sent. You have all your data. The reference of the responsible personnel will be Louise' secretary. She will receive the email. The vendor will receive the email. The lab owner will receive the email. So everyone knows who's been placing the email, this email order, when it has been done, and this is very secure, instead of just giving a call and waiting for what we have been ordering. So I'm not going to send an email. I'm going to print it. And there I am going to post or not to post. If I post, the order will be removed from the orders to send and which are prepared. So I post it. I'm not going to print it. Let's go fast. And that's it. So now in the planning supplies, I have no more orders to place. Then after the order is planned and sent, I go to sent order management. One day or several days after, I will receive what I've been ordering. So here is the sent orders. And you see every line is a different order. And you see that the background of some of them is yellow. Yellow means that your order was sent, received, and paid. And then it's becoming closed. And this is what you see here. When it's closed, it's paid, it's finished. This order, and this order are just open. Let me open one of them and we check. What we have here, we have some components which have been ordered to ANPA Medical. So what I can do here, I can click on this button and all the components will be selected at the same time. I click on received. This means I have been receiving all of them together. So I can put some comments that I like this or I don't like this, or the parcel was broken when received. And I have the delivery date, which is, let's say, today. I can add the number of the bill, the invoice date, let's say yesterday, the amount, be careful about the amount. I put the amount, and if in this case I am 5%, the full amount will be reflected here. The amount of the VAT at 5% is here, and the amount without VAT is this. And you do not have to calculate anything. All this is done automatically. So I say, yes, I'm going to pay. I'm going to make a check, and it will go to E-MedicalManager Supply Payment. So doing that, I saved that. And is all paid? Yes. Okay. All has been paid. And you will see that in the list, the background will become yellow. Okay. This means that this order is closed. So in some cases, I want to know that we have been buying one item like this. Where did we buy this item? And automatically, it will show you in which order you have been finding these orders. So let's go to Castable. And it will show you where you've been ordering and in which order you've been doing that. So that's interesting for the traceability of what you are ordering. When something is ordered, then you go to the inventory to know where it is. This is the inventory and traceability. And we have been ordering, let's say, definitive screw, definitive. We received these 4. Okay. It was done by COSI coordinator, the Department of General Supplies. Where did we store that? In the stockroom. And the traceability, you can read the traceability on the bottle of what you've been ordering. So I don't know if you see that, but I have been receiving this bottle. Okay. Can you see that? So I am going to scan it. So I go here and I scan. And automatically the traceability of this is done. I don't need to do anything. It is traceable because I have been scanning it. Do I need to write anything? No. What I need to write is the expiry date, because the expiry date is independent to the traceability. So in this case, it might be something like this. What is the status of this? It is in stock. And at the same time, you've been doing all these things and you can save. So now, the next time I will use this, one of this screw coming from the stock room and using that, I will change the status in the inventory from in stock to used. It is used, and as long as it is used, it's not in stock, it is out, and I can save. Voila. Do you follow me for that? So you see, it's very simple. The person who is receiving and is giving the products has only that to do. And based on this, it will be very easy to know where you are based on this. So you go to the report, 2 days inventory, and in 2 days inventory, you find that you have 7,000 dirhams in inventory, and this is the list of your inventory. If you want to get a direct access to your product, you can click here, or if you want just to view it on the same line, you can view it like this, and it would be shown at the bottom. And at the bottom, you see the details of that. So no need to open a new window for that. You can manage everything from a single same page. So this is the inventory. And if you don't want to go to the inventory, you can have a setting. This setting is that you will receive every day or every week or every month the level of the stock. So you will decide who will receive that, the responsible personnel or you who are the owner of the dental lab, and you will get the direct access, and the PDF file will be sent to you with all the details of your inventory. So that's for the inventory and for the supplies order. I don't want to go deeper, but you can do much more than that. Let's go to the lab orders. Second part. So I click on the lab orders, and here I have the list of all the orders which are received by your lab. So they are coming directly to you like this, or you have to go from the paper which is written with the order, and you have to implement as a new order. We are fully against this because this is not the way of the future. We are talking of paperless. Paperless means less paper. And when I started working with dental lab, we used to fill 1 page. After we had a copy of this page, we used to fill 2 pages. And now we are filling more pages, 3 pages. So when we are going to stop with that, it's not needed. We work digitally and we can get access to the same page from everywhere. So stop working not paperless. Go into the new dimension of document managing system. So the practitioner will be this one. The patient's name is, for example, I put a name, Pierre, long. The word description will be 2 zircon, let's say. And this should not be done by you. In the future, it should be done directly by your client. I select on which tooth. We have 2 numbering system. I select, and I want a zircon multi-layer on both of these teeth. For the shade, I click here, and I'm going to add the shade of the patient. It's going to be attached to this. And I have been doing an impression of the lower, impression of the upper. I can click on call me before proceeding, and I send to be finished for 29 because I am in a rush at 10 o'clock. Okay, I save this. This is the order you fill for your clients or you receive directly. No need to do what I've been doing if your clients are using the E-MedicalManager dental lab orders. If he has that for free, you will be able to receive all that really in time for free. And every time you have a new order, you will receive an email to open the new order. So this is really very, very simple to manage and very, very easy to control. What I have to say also is that when you are saving your case, the lab, the date, the practitioner, all this will be frozen. You cannot get access to that. Why? Because we need the traceability. And as long as we need the traceability, we cannot change things. Only in open comments, you will make changes. So you say, whoops, I've been making an error. The teeth are 41, 42, and it's not 1121. Okay, so again, you will receive that, and we can save modifications, and this will be received from your client or to you. So what you receive also is this. No need to have a special program. You just click on the pictures, and they are open on a new tab, and everyone can check now the color, the shade, the transparency, and everything of your case. So now, if you want, you can also, and this is done by your customers, they ask to print. And when you print, you can print in a format which will be A5 instead of A4, because you are working on A5 and 90%, and you will get a print which is going to go into your dental box in the lab. So once again, we are working for the lab. The center is the lab. So the case is received, and what do? We plan. We need to plan. And this again is fantastic. You have the REC. The REC is reception, planning, and plaster. This is, let's say you received on 26. Who received that? Responsible, Johnny, coordinator. After, Lucas is going to do the job. Lucas is going to do the job. Jody is going to control. And then Speedy Driver is going to make the delivery. So this will be based on a week delivery and a week work. This means that the first date, this is the receiving date, will be followed by 26, 27, 2 days, 29, 1 day, 30, same day delivery. Okay, so if you do that, you will see that, okay, today we are going to add, Luca, and on the same day, we are going to add this and the delivery, because we need to run fast. Okay, so you can change the date if you want. You can add new dates. You can change the date of the invoice if you want to. All these things can be done independently. So the manager is going to give the job to all these people. So we save that, and we save the modifications of the planning. The planning is done. What do we do now? We are going to print some labels. So we click on print labels. So I have a label like this. This kind of label is a label that you can put everywhere. You see the label? I'm going to show you. This is the labels. Do you see the labels? These are the labels. You can put this label on the box. You can put this label everywhere you want. What is the use of this label? The use of this label is that if you have something, an invoice, a paper, a document, a box, anything, just scanning on that will open the file. We are going to do it to show you. What you can do also, you can print that, and this is another kind of prints that you have. I show you again in bigger like this. In the same 5 centimeters by 2.5, you have this kind of prints. You cut this in two, and this will allow you to identify your plaster cast. So you don't need a lot of printers. You need only one printer, and on this printer, you will have all kinds of labels that you need to use in a dental lab. So let me go back to you. We do that. We save the modification. We've been doing the printing. The printing is done. Execution I will talk to you about later. And we go to the materials. On the materials, you can select the materials which have been used, and this is mandatory. By law, you have to say which material have been used. And I am going to show you 3 different ways to work on the material. The first one is you select a material like this, for example, family type, manufacturer, Ivoclar, description, it's E-Max Ceramic Dentine A2, and you write the reference manually that you can see on the box, okay? What you can do also, from the settings, you can print this. This is the print of the ongoing material you are using. And you see that you have the details of what we've seen, and you have a QR code. So just scanning the QR code, let me show you. Here, you have that we've been using this, and this is the material. We can save that, and this is saved. So we have one material which has been added manually, one material which has been added with the QR code. What you can do also, if you don't want to use a list like this in the lab, you can write on your ceramic vials, you can put a label like this. The label is edited in the program. You don't need to have anything. Everything is included in the program. And if I have been using A1 ceramic for this case, I go here, I click on that, and I have the ceramic I've been using. I save it, and it shows that I have been using this material, the Ceram A1 for this case. So you see, you have several ways to implement the materials. On the vials, on the ongoing material list, or manually selecting which material you are using. Okay? So the materials are done. Let's go to the work. To the work done, you have the same kind of approach. On the work, you have 3 levels of things that you can invoice. The first thing is what you do. You do a crown, you do pontic, you do a zircon, yeah. The second is alloys. And the third is supplies or other things like implant components or whatever you want, okay? I will focus today on the work done. So you go on QR code and you have your price list. Your price list is there. So it's very easy. So let's say we are going to go to do a zircon crown. I am going to scan, or E-Max crown, I'm going to scan, and I have my crown. If I've been doing another job, I can scan a series of things. When you've been scanning and verifying that, you save. And when this is saved, you can say how many things, items you've been doing. So you have a code, you select the teeth, and here you have the discount, for example. The discount can be a percentage or can be an amount. And the VAT can be cosmetic treatment, and you will have 5% VAT, for example. Okay, so this is the kind of doing for a work on a case. Huh? So let me go to, I cancel that. I go to another case, which is open already. And you have the work done. The works have been done here, okay? And the print is there, so you can print that. So on the print, you have the QR code. So if you see a print and you don't know to which thing you need to link that, you just scan it and you will find the case. And all the details are there. All the mandatory details in this country or other countries. So you go to payment if you want to pay in one time, Okay, you can go to the payment and you can send the invoice. You can go to print the invoice, but you don't send it. When you decide to send, you need to click on send. When it's clicked on send, this means that it's gone into production because someone needs to pay for this invoice at that time. So we go back to the orders and you have the list of all what you've been doing there. Let me show you something else now. You get the dashboard. When you come in the morning, or even if you are not in the lab at that time, you need to know what's the dashboard. This is the dashboard for Speedy driver, who is going to delivery 10 cases, okay? So this will be out, okay? Then Robert, lab technician, he has 6 cases with 13 teeth to do. So these are all the cases. If you believe it's too much, you can go to the case, you click and you change, you give the job to someone else. You go to Josie, coordinator, and these are all the cases that needs to be prepared for this day. And then you have Luca, lab technician, and you have the job for the day. Okay, this is for the whole dental lab. You can print that, or you can save it, or you can email it. I give you now an example. I am Robert, and I just finished doing the quality control on this. So I click here, and I click on quality control, and it means that at this time, okay, I have been doing my job. Doing that, I save, and when it is saved, the background will come yellow. So we know that the quality control on this case has been done, and then the driver, Speedy driver, can deliver the case because the case was done. Okay, so this is very, let's say someone needs to do the metal before the ceramic. Robert is responsible for the metal, he's doing the metal, and then the other one who is going to do the ceramic will be able to do the ceramic. Of course, we can select what and who is doing what. Okay, this will allow you to have a dynamic dashboard which is going to follow all the activity of the dental lab at any time. And you will have a tracking with the time. Not only that, you have the tracking of the time. And if you're interested in that, you can also send that the quality control was done. You send that and it is sent to your client. You can send that the delivery is on the way. They don't need to call you because you are sending them that Speedy driver is on the way to deliver them. Only just saying that here, who did that? Speedy, and what he did the delivery, okay? And you send. And the client will know that the guy is on his bike to his clinic, okay? So this is the way you can do, and you have many other ways to do it, but it's very simple. And it saves a lot of time. This is what you have to have in mind. Now there is another question. I would like me to know what is my job for the next 7 days. I am Luca, lab technician. I click on who I want to know. And here I am for Wednesday today. I have to do 9 cases, 20 crowns, and I have the details of my job here. For Thursday, I have nothing. For Friday, I have these 3. And this is done step by step based on the planning that you've been doing at the lab. If you want to change it for one reason or another, you go to the case and you can change it. So this is the job for the next 7 days, and you can select for who it is. There is another tool which is interesting, is the responsible personal activity. You want to check who is doing what in the clinic, in the lab. So Lucas, dental lab technician, overall, but we can say over the last 6 months, has to do 4 cases and this number of units. Josie has been doing that. Robert has been doing that. So you know who is doing that and how many cases and how many units are done by the different lab technicians. So this is interesting also to know. And this is a report. We call that report because it is in yellow, and the report is responsible personal activity. If you want to know what's the dynamic inventory report, you can do that. The inventory report is on what you've been buying, and you know how much you've been buying on the last days and last months and all that, and you can control what you're buying externally. So we've seen on orders to the lab, we've seen all that. So if you are working with a special program, which is called Zoho, it's a very well-known international accountant program, everything you write here will be automatically synchronized to the lab. The accountant has nothing to do. Everything is synchronized in real time, okay? But once again, you need to feed the lab. You need to give them the information they need. Okay, so the lab technician, if you want to do that in a different way, what you can do, you can export the sales done to the accountancy. What's a sale? It's when you send an invoice, the sales are all this, and you have all the sales which have been done, and you can work on the sales. You can also work on the money you receive. So you go here, and every month you are sending a statement to a client, and he's going to pay you. Let's take an example. I add a new payment based on the statement. So the payment title will be July group payment for a company, which is let's start with a clinic, the Palm Dental. The Palm Dental. So we select the Palm. We have the Palm Dental clinic here, and the Palm Dental needs to pay this amount. So if you click on this, this will be paid. The amount is decreasing here, okay? The amount is decreasing here. The amount is decreasing here. The amount is decreasing here. So with all that, if you've been receiving this amount received is this, for example, you've been receiving this check, this means that the rest is zero, and your client has been paying everything. In some cases, the client will not pay like this. He will say, okay, I need only to give you, I can only give you 6,000 dirhams, let's say. Okay, so you have a rest of 2,200 here, and you will pay this amount in a partial payment. For that, you click on this sign, and you will get a partial payment today, partial payment by check, for example. You receive this, and no need to calculate anything. It will update your invoice in an exact way. And the exact way is that you've been getting a payment with a partial payment on that. Okay? So let's go back to that. And of course, you can export all the payment directly, or doing nothing. If you work on Zoho, you will have the same. So I would like to show you more about the storage. So we are using more and more information like STL file, like pictures, like shades, like design, like all this. And E-MedicalManager will give you a place to store information. So you can store information like this. I open this one, and I have been storing for patients Allah, for the practitioner, this practitioner, and this is the Allah shade. So if you receive another case with Allah without the shade, you will be able to find it because it's in your storage now. Okay, so you can send that to a lab order. Let's say I have a patient whose name is Allah. I can send this one, I tick it, I send it to the lab order. So I have the list of my orders. Where is Allah? Here. Okay. I have Allah, and to Allah, I am going to select and save. I delete from storage or I keep it? I keep it. So now, if you go to this case, Allah, okay, you will see that we have the pictures that we've been getting from the storage. This is interesting for pictures, but it's interesting also for STL file, because you can store the STL file. But you have so many STL files now that the host will be charged for you in such a way that you don't want to pay that much. So instead of loading that to your storage, you can load it to your client storage, and you have access to load to the client. So this, let's say it's an STL file, you load that to your client. Okay, you load to the client and you write the patient's name, it's Allah. You write, you fund it, and we will fund it or create a new one from the client. So based on this, you can have a storage on your side or on the side of the client. So this is very interesting for you, based on the fact that you don't want to overcharge. I mean, the dental clinic, they can hold their data, but you don't have to hold them for them. So that's something important to understand also. I can show you something else based on the network. We are at the network now. Huh? So what is called renewals and tasks. This is a fantastic tool, because in all activities like a dental clinic, an hospital, a dental lab, an health center or whatever, we need to do things and we have dates for that. So we call that the renewal and tasks. So you see here, you have a transparent background, a red background, and a yellow background. These are events, okay? The first event is a visa to take for Dr. Khalid, okay? And this has been executed by John, who is the owner of the lab, and this is the date of execution. It's yellow, it's fine, okay? This one was to get the insurance of the bike #1, and this was not done, okay? So it becomes red. We know immediately if it's too late. The lab rent, 3 years renewal. This is all the renewals you have to do for this month, because the report is this month, okay? You have this way to present the things. You have this way to say that you've been doing the case and when, but you can present that in a calendar also. So you click on view and you have the calendar view. So it's July. You have visa for Khalid, it's done. This is the insurance, and this is the registration. So you still have some time. We are today. You can take the insurance, and then you will do the registration for the bike. And then you will click on the insurance that it has been done. I click, I scroll down. The state 2, which is active, will be done. And I say today, who John has been doing that. I save, okay. And saving that, the insurance has been done and the color is changing. So you can manage all these things in very easy way, and you can manage your time, and you are not going to expect to lose things because of this amazing renewal and task instrument. So they say to me that I have to conclude now. The conclusion is very simple. When you are a dental lab, even a very small dental lab, it's mandatory for you to edit things in a proper way, to track the things, to know how you spend, to know where is the money. You have a tool in that, I didn't show that to you, which is called where is the money? Where is money? You don't talk to an accountant. I talk to a dental lab technician. He wants to know where is the money? Where is the unpaid money? So total invoice is this, total received is this is the balance. So if I go here, I have some paid invoices, And if I go here, the payment status outstanding, I will have only the outstanding, and on the outstanding, I can send to separate, so I can send a message to all these people separately. Doing that, I can print separately, and then this is what they are going to receive. They are going to receive their statement every month based on all what they didn't pay before and what is not paid this month, or what is paid partially. You have nothing to calculate. Everything is calculated. Don't count on the accountant to do that. You will do it automatically because you will manage the money directly. You don't need someone to do it for you. In 2 clicks, the secretary can do that. So this is the way it's done. If you want to know more about this, you can print all, and then you have the list of all your payment. If you like working on that, it's easy. You can print this. And if you want to know what is this case of patient Elrain, you go here. You will use your scanner, you scan that, and you will open the file. You will open the file of the patient. So I am going to give you a last thing after I stop. So order to the lab are here, okay? And here by default, the cursor is here. I have this, it is, let's say, it is on a page like this. I have this. I have an invoice like this, or I have a paper, I have a box. I'm going to click on that, okay? And it gives me the file of the patient. I click and I have the file of the patient with everything. No Excel file can give that to you. No paper file can give that to you. Only document managing system using QR code can give that to you. And we will go much further. It is not stopped. We will go much further for identifying something else that you are working on every day. It is the deliveries. So we know the deliveries like this, but in a very short time, when you will have all that, the responsible personnel will put a finger here, click, 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 to validate that they have been receiving that. And in a very short time also, you will have the location of the driver who is delivering the prosthesis to you. You will know on the map where he is, close to your clinic. No need to call the lab. The clinic will know where is the guy on the bike, and you will know too. So based on this, we are working on a completely new, amazing, new document management system. So if you are allowed to work on that, your clients will be allowed to work on a free program. If they want to upgrade to a new program and a full program on dental, they will be allowed, and they will lose nothing of the information they have been sending to you. But if they want to stay on their system, they will be able to stay on their system. So this is the way it's working, and I would like to thank you for that. And if you have more questions and information to draw from us, we have a lot of tutorial movies, information, movies, presentation, and you can be in touch with Anpa Medical, and it will be our pleasure to put you in touch with Dr. Sumia, who is an expert in that now, and who has clients all around the world. So I thank you for your attention, and we will do more than that to make you discover what's the other part of that in different systems. Thank you for that.